Ladies and gentlemen, from the Carlisle Hotel in New York City, the President of the United States.
Good morning. Be seated. I have to say, for the most part, we've done good for ourselves. We have just introduced a massive investment in improving the quality of our health insurance. I love working side by side with Hillary on this policy, and I think it matters for the world of difference. And I think things can work out with investment in healthcare, NAFTA, and of course the bill that's going to create something, one of my visions, AmeriCorps. And with that, I'm open for questions.
Mr. President, this is Mark Ludwig with Andrew House program. I have a question. Why increase the health plans in governments when already we have a federal system that handles that through Social Security and Medicaid and Medicare?
Personnel downs.
No, Ms. Myers, I'd like to answer that question myself. I still think the healthcare needs to be expanded. Well, I realize we've made a lot of difference with tax increases and spending cuts. We've had to make a lot of hard decisions, and that means doing our best to tighten our belt, but at the same time, having a chance to invest in confiscation of assets and such from the rich. I think that this plan could work very well.
Mr. President, from the Andrew House show again, some information has surfaced about Whitewater. What is your policy about that? What is your thinking about that?
This has already been covered on the campaign trail. I am sorry, but I will once again repeat it. It was a bad investment. That's all it was. If anyone was hurt by it, I am deeply sorry.
So, Mr. President, no more questions from this gentleman.
Michael Carter from the Blake Carter show had this question. Sir, why expand upon the model that's already working with Medicaid and Medicare?
To be quite honest with you, the reason that this happens is because even with Medicare and Medicaid, people fall through the cracks. There's too many gaps in these programs. We want to hold some of these medical conglomerates and drug companies accountable. We've tried to voice the idea of price caps. Both sides of the aisle will not approve it. It's not bipartisan. So we've had to kind of skim it down a little bit, but still keep the vision of health care for this country. All right. We have time, I think, for one last question. Molly Barron from the New York Times.
President, one more question about Whitewater. Have there been any open investigations that you know about at this time? Anything that might harm the president or the presidency or you and Mrs. Clinton?
If there are any current investigations, I'm sorry, I cannot recall. I just know that some officials in Treasuries found out, and we will address this. All information about Whitewater will be given on a need-to-know basis. Now, I have said enough about Whitewater. I came here to talk about the investments in the healthcare, NAFTA, and expanding programs for school loans and school lunches so that we can take care of the American people. Thank you.